Hey everyone, what's up? This is Dr. Charlie Johnson, PT. Appreciate you checking out my channel. In this video, I'm going to share with you a live coaching call that I have with a woman named Lisa, who is a member of my private coaching program, the Glute Relief Accelerator program, where we teach people all around the world with back, butt, and sciatica problems how to fix themselves naturally using their mind and movement as medicine. In this case, Lisa had been dealing with right buttock pain as well as some low back and mid back pain for about 5 years. She had tried going to the chiropractor, getting injections in her back without relief. And so, she tried relying on others to fix her and said, you know what, wouldn't it be neat if I could actually learn to fix myself? And that is my goal for you. So if you're watching this and you're wondering, hey, is there a possibility I could actually learn to solve this? Is it possible that I could be taught what I need to do to figure out how to become pain-free? The answer is probably a heck yes. In this case, Lisa had trouble walking. And so I want to show you a snippet, again, a live coaching call of sort of what we do in action as I help her understand the exact process she needs to go through step by step, connecting the dots so that she can walk once again pain-free. Check it out. So to be clear, right from the top, so there's no confusion, walking can be a bit yucky, but you notice that when you rotate your legs certain ways, you can change the symptoms. You get the concept, okay? So if this is the midline, right, rotating your left foot out feels better, rotating your right foot out feels worse. Is that accurate?
Yep.
Okay, so again, these are tweaks. These are ways you can modify the way that you're walking such that, hey, when I walk like this, Charlie, I realize that when I rotate my left foot out, kind of like a duck, it feels better. When I rotate my right foot out, it feels worse. Great, okay? Tweaks drop clues like cookies drop crumbs. So now we can use these tweaks to inform, what motions might be valuable for you. But I would agree, you can't just, I don't expect you to walk like this for forever. So if I don't expect you to walk like this for forever, I guess you could if you got in a pinch, because you can say, okay, well, now I can adjust my pain. So it's good to have more movement options to find comfort when you're walking. But more importantly, and where I really want you to think next, right, like high level stuff, is okay, when I rotate my left foot out, that seems valuable and seems helpful to me. So how could I do more of that, and how might that show up in the form of an exercise, right? So that's how that modification of movement that you find helps can start to make you think, well, how does that look in the form of an exercise? How could I take this thing and turn it into, bottle it up, right, and turn it into using movement as medicine? That's a pill bottle, right? And so then what we start to do is we start to say, okay, well, left foot out, how could that show up in the form of an exercise? Well, number one, you could be laying on your right side, and you could be maybe doing a side leg raise with your left foot slightly turned out. Okay, that's one option. All right, now we'll talk about how to segregate these things and make sure they work. The second thing would be that you could just stand there, and you could just be rotating your left, is that your right leg? Sorry, that's your right leg, hold on. Your left foot out, right? So maybe you're standing on a paper plate, or maybe it's a sock on a hardwood floor and you're doing this. You can see me here. You're doing this, you're literally just, right? Yeah. Maybe you're letting your body kind of roll with it, right? You're doing that, all right? And you're doing the twist kind of thing, all right? Mm-hmm. The next thing is you could literally do the twist. So you could stand there, and you could keep your feet stationary, so your feet are straight ahead, but you could rotate your trunk one way or the other. So if you want your left foot to theoretically be rotating out, I would rotate my trunk this way, which makes my left foot out. Does that make sense?
Yep.
So you'd be doing a right standing twist on a fixed foot.
Yep.
Right? So we've got a I'll go the other way. We've got a right standing twist. All right. The fourth way might be, again, that when we rotate our foot out, what are we doing to the femur? All right, we're externally rotating, we call it. So we could do this. We could lay on our back, and we could let our legs fall to the left, right? And we could be repetitively externally rotating that left leg in this case. So it would, again, it's hard to draw, but it would be something like that. Wow, it's really bad. But so lying, legs fall to the left, kind of opens up the left hip, for lack of better terms.
Right.
All right. So you've got the standing, the little pivot, where your left leg is repeatedly rotating out. You got the left leg raise with a slight bias with the leg out. And we could probably even come up with more, okay? But these are just 4 options off the top of my head to say, okay, now I'm picking up what Charlie's putting down. I did this little twist. I can't walk like that for forever, but it gives me some good insight, and it gives me a clue as to what my body might prefer, right, movement-wise within that hip, for example. We could also do the same with the other side if we wanted, and we could come up with options there. But let's start with this side for the sake of keeping it simple. Now, how can we possibly bottle that up and use movement as medicine? Now we've done some detective work. Well, we've got 4 primary options, and heck, we could probably come up with more, but we don't need more per se. We've got some things to test. Now what we need to do is now we need to plug them into a process. So how do we know if these are emotions that, number 1, we should try, and number 2, if they're of value? Happy birthday. I don't know why that happened. All right. Is it your birthday? No, it's not.
No,
I'm sorry. Okay.
that was
so
funny.
apparently this sign makes a birthday thing happen. Okay, so how we do it? So number 1, there's 2 things that we need to consider. There's 2 rules, if you will, right, that need to be met. All right. Number 1, the emotion must feel safe and or what we call yummy.
Mm-hmm.
All right. So what I would do if I were you is I'd say, okay, which of these motions, and we would have to try each of them. You can probably try them on your own, but you get the idea,
Yep.
are yucky. All right. So for example, let's just say you do this leg raise. Just do 1 or 2 reps of each of these. Ugh, that's yucky, Charlie. Ugh, that's yucky, Charlie. Ugh, that's oh, but this is yummy. Okay, good.
Right.
So now if that's the case, right, we've got 1 option of the 4, because the other ones are yucky, right, that we could potentially try on because it's the only one that meets this first rule. Does that make sense?
Yep.
If you've got all 4 that are yummy, you've got 4 options. Awesome. Okay. The second rule that needs to be met is that it needs to immediately improve your movement experience, meaning it's got to decrease your yucky motions. I'll say yucky motion. You've got to have a motion that feels safe, feels yummy, and it's immediately got to make your yucky motion better. So then what do we mean by yucky motion better? All right. Well, we have to identify a motion that feels maybe not so good. All right. And so what would that be for you? It could be anything. Heck, you could even, if you want, you could even take walking, although the only challenge with walking sometimes is it's many motions, but regardless, it still is a movement or a string of motions. But we could pick 1 yucky motion. So if you had to pick a yucky motion that you wanted to see kind of get better, that you know reproduces your symptoms, what would you pick? Do you have one off the top of your head?
From the charts that we've been doing.
Yep, from like self-assessment or outside of it even. If
So
you do, for example, a trunk twist left, is it yucky? Does it cause symptoms?
trunk twist left. Yep.
Yeah, it's yucky, right?
Yeah.
Okay, cool. Okay, so
I would say right now is worse than left.
okay, got it. So let's just say, for example, right trunk twist. All right. By the way, if right trunk twist is your yucky motion or is a yucky motion,
Right.
this right standing trunk twist, you're gonna ixnay it pretty quickly, right?
Yeah, I get it.
All right. So that's not an option for you. It was a good. It makes sense, right? In the logic, and in the problem solving mode, but when it comes to actually doing it and plugging into a process, it doesn't make sense because it doesn't meet this rule.
Yeah,
right?
process of elimination.
Exactly. So you've got right trunk twist, and that's yucky. All right. Now what we need to do is now we need to take 1 of these safe motions, for example. Okay, let's just say, again, you just get the idea. All right. Let's just say this this lying pivot, the pivot. All right. And we need to do it. How do we know if it's safe and yummy? We do it once or twice. Then we do it. We do 1, we do 2, we do 3, we do 4. Their left leg out, 5, 10, 11. Okay, maybe 3 sets of 15. We just sample it. Right, knowing that it's safe. And then what we do is what do we do? How do we tell if something works or not? We know it's safe. We know that little pivot is safe, maybe.
That it's helping.
Yeah, and how do we define if it's helping?
And then it's yummy.
Yeah, well, it's yummy, but then immediately afterwards, we retest. What do we retest? This right trunk twist, and it gets better.
Yeah, retest what the problem.
Yeah, exactly. See if it fixes the problem. So now let's just say theoretically that's what happened. You know 2 things. Number 1, you know that, okay, this thing is yucky. So we've got a baseline. We then know that this thing is yummy, and the chance of you doing yummy safe motions over and over again and you getting worse is probably not very high. Way better than if you do yucky things in here. All right. That would generally risk a flare-up. But just because something's yummy and safe doesn't mean it's going to make you better. So then how do we confirm? We do it 1, 2, 3, 10, 15, a few sets, right? And then after we gobble it up, we go back and we check to see, hey, that twist, what happened?
Yep.
Ah, it got better. It's a safe motion that not only feels good and is safe, and therefore the risk of it flaring me up is pretty low, but it immediately in the moment makes me feel better. Check, check, boom, you're on to something.
Right. Yeah.
Make sense?
It makes sense. Yep.
That is how you go from testing, right, and doing detective work as it relates to maybe how you're walking or how you're bending or how you're sitting or how you're doing whatever. The conceptualization of this idea, oh, this is a clue.
Right.
Now I've got, okay, how could I bottle that thing up, that tweak, which helps me? How could I bottle that up, right, and put into it a specific motion I could potentially gobble up whenever I want as medicine? Well, here are some options, just being creative. We made these up, all right? Then, okay, well, those are options, but where do I go next? How do I know if it's going to be helpful? Is it safe? If not, we cross it off. We don't do it. If it is safe, we can circle it or start, and then we can plug each of these things into the process to see if it meets the second rule, which is it must immediately improve your movement experience. And what do I mean by that? You start with a yucky motion, you do it, you rate it, you score it, you get a sense for what it feels like. We have you rate it. You go do it, yummy, safe. Then you retest it and immediately see. If better, awesome, you're on to something. If it's the same, don't waste your time. We need to change it up and tweak it. If it's worse, absolutely not. It might feel good and safe after one rep, but doing a bunch of it actually makes you feel worse.
Yeah. Okay.
Got the concept?
Yes.
Okay, what questions do you have about that?
Well, nothing. Seems pretty simple to me.
All right, so there you have it. We take Lisa from a place of not knowing what to do, unable to walk, to knowing exactly what she needs to do to get walking pain-free. Now, this is an iterative process. We need to continue testing, but you can see the process that we took her through. Hey, we tested some things out. We found that these things make me feel better. Great. How could I take that concept and bottle it up and put it into a movement that I can potentially use as medicine? Brilliant. The third thing, okay, now how do I test things, right, in these individual variables such that I can determine immediately in the moment if it's worthwhile, if it's going to help me, if it's a waste of time or something I should avoid because it's going to make me worse, right? And so this is a process that we can walk you through as well. So if you're like Lisa and you want to not rely on other people but would rather learn to fix yourself naturally, then go ahead, click the link below to apply to work with us. We actually work with people all around the world. This is my specialty. I work with people with back button sciatic problems. We teach you how to use the power of your mind and movement as medicine to get back to living a life that you love. Go ahead, click the apply link below, set up a time to chat with us, and then follow instructions to submit a case review. I review all cases personally. If I don't feel confident I can help, I will just reach out and let you know. Thanks so much for watching. Chat soon.